Hi everyone, I'm Jayashree Batumale and today I'm going to talk about sectional anatomy of knee joint. The knee joint, which is also known as tibiofemoral joint, is the largest and most complex joint of the body. It is a modified hinge joint because its primary movement is a uniaxial hinge movement that consists of three joints within a single synovial cavity. Laterally is the tibiofemoral joint between the lateral condyle of the femur, lateral meniscus, and lateral condyle of the tibia, which is the weight-bearing bone of the leg. Medially is another tibiofemoral joint between the medial condyle of the femur, medial meniscus, and medial condyle of the tibia. The third one is an intermediate patellofemoral joint. It's between the patella and the patellar surface of the femur. Next, I'm going to talk about anatomy of the knee. As I told you earlier, it is one of the largest and most complex joints in the body. Knee joins the thigh bone of femur to the shin bone of the tibia, and is a smaller bone that runs alongside the tibia, and the kneecap are the other bones that make the knee joint. Next one is the bones of the knee. The first bone is the femur. The femur or the thigh bone is the longest, heaviest, and strongest bone in the body. Its proximal end articulates with the acetabulum of the hip bone. Its distal ends articulates with the tibia and patella. The body of the femur angles medially, and as a result, the knee joints are closer to the midline than the hip joints. This angle of the femoral shaft is greater in females because the female pelvis is broader, and the proximal end of femur consists of a rounded head that articulates with the acetabulum of the hip bone to form the hip. The head contains a small central depression called a fovea capitalis. The ligament of the head of the femur connects the fovea capitalis of the femur to the acetabulum of the hip bone. The neck of the femur is constricted region to the distal head. A broken hip is more often associated with a fracture in the neck of the femur than with the fracture of the hip bones. The greater trochanter and the lesser trochanter are the projections from the junction of the neck and shaft that serves as a point of attachment for the tendon of some of the thigh and buttocks muscles. The greater trochanter is the prominence felt and seen anterior to the hollow on the side of the hip. It is a landmark commonly used to locate the site in the intramuscular injection into the lateral surface of the thigh. The lesser trochanter is inferior and medial to the greater trochanter. Between the anterior surface of the trochanters is a narrow intertrochanteric line. A ridge called the intertrochanteric crest appears between the posterior surfaces of the trochanters. Inferior to the intertrochanteric crest on the posterior surface of the body of the femur is a vertical ridge called gluteal tuberosity. It blends into another vertical ridge called linea aspera. Both ridges serve as an attachment point for the tendons of several thigh muscles. The expanded distal end of the femur includes the medial condyle and the lateral condyle. This articulate with the medial lateral condyles of the tibia. Superior to the condyles are the medial epicondyle and lateral epicondyle, to which the ligaments of the knee joint attach. A depressed area between the condyles on the posterior surface is called the intercondylar fossa. The patellar surface is located between condyles on an anterior surface. Just superior to the medial epicondyle is the abductor tubercle, a roughened projection that is site of attachment for the abductor magnus muscle. The second bone of the knee joint is tibia. The tibia or the shin bone is the largest medial weight-bearing bone of the leg. The tibia articulates at its proximal end with the femur and fibula, and at its distal end with the fibula and the talus bone of the ankle. The tibia and the fibula, like the ulna and the radius, are connected by an interosseous membrane. The proximal end of the tibia is expanded into a lateral condyle and a medial condyle. This articulates with the condyles of the femur to form the lateral and medial tibiofemoral joint, which is the knee joint. The inferior surface of the lateral condyle articulates with the head of the fibula. The slightly concave condyles are separated by an upward projection called the intercondyle eminence. The tibial tuberosity on the anterior surface of the point of attachment for the patellar ligament. The notch articulates with the distal end of the fibula to form the distal tibiofibular joint. Of all the long bones of the body, the tibia is the most frequently fractured and is also the most frequent site for an open fracture. The third bone of the knee joint is fibula. The fibula is a parallel and lateral to tibia, but it is considerably smaller. Unlike the tibia, the fibula does not articulate with the femur, but it does help stabilize the ankle joint. The head of the fibula, the proximal end, articulates with the inferior surface of the lateral condyle of the tibia below the level of knee joint to form the proximal tibiofibular joint. The distal end is more arrowhead shaped and also has a projection called lateral malleolus that articulates with the talus of the ankle. This forms the prominence on the lateral surface of the ankle. The next one is the patella or the kneecap. It's a small triangular bone located anterior to the knee joint. The broad proximal end of this sesamoid bone, which develops in the tendon of quadriceps femoris muscle, is called the base. The pointed distal end is referred to as the apex. The posterior surface contains two articular facets, one for the medial condyle of the femur and another for the lateral condyle of the femur. The patellar ligament attaches the patella to the tibial tuberosity. The patellofemoral joint between the posterior surface of the patella and the patellar surface of the femur is the intermediate component of the tibiofemoral joint, which is the knee joint. The patella increases the leverage of the tendon of the quadriceps femoris muscle and maintains the position of the tendon when the knee is bent and protects the knee joint. Okay, next let's see the knee joint. Here is the femur or the thigh bone. This is the base of the patella, and this is the anterior surface, and this is the patella as you can see here, and the apex, the patellar surface, lateral epicondyle, lateral condyle, groove of the popliteus, lateral condyle here, the tibial tuberosity, head, and the neck, and adductor tubercle here. Okay, the next one is the pes ansi, a term for the bony landmark located on the tibia. The attachment site for three muscles abbreviated SGT, which is the sartorius, gracilis, and semitendinosus, literally meaning goose foot because the appearance of the tendons and then inserting. This is over here, as you can see here, the sartorius muscle, the gracilis, and the semitendinous. It's inserting here, so it looks like a goose foot. Next one is the bursa sac, which is the pes ansi bursa. Is located under the insertion to act as a friction reducer. So the bursa sac will be here under this, which act as a friction reducer. The next one is the ligaments of the knee. As you can see, the knee have two ligaments, which is the cruciate and the collateral ligament. Okay, the cruciate, which is the most important ligament in providing stability of the knee, and it also has the cruciate is divided into two, which is anterior ACL, anterior cruciate ligament, and posterior cruciate ligament. It is attaching to the tibia and fibula. As you can see here, here's the ACL and here's the PCL. And it also has collateral ligament found on either side of the joint, responsible for providing sideways stability by holding the bones together. It is known as the medial collateral ligament and lateral collateral ligament. Here's the medial collateral ligament, as you can see here, and this is the lateral collateral ligament. Okay, this one is the collateral ligament. Okay, tibial collateral ligament, which is also known as the medial collateral ligament, is a broad, flat ligament on the medial surface of the joint that extends from the medial condyle of the femur to the medial condyle of the tibia. The tendons of the sartorius, gracilis, and semitendinous muscle, all of which strengthen the medial aspect of the joint, cross the ligament. The tibial collateral ligament is firmly attached to the medial meniscus. Okay, next one is the lateral collateral ligament, or also known as fibular collateral ligament, which is the strong and round ligament on the lateral surface of the joint that extend from the lateral condyle of the femur to the lateral side of the head of fibula. It strengthens the lateral aspect of the joint. The ligament is covered by the tendon of bicep femoris muscle. The tendon of the popliteal muscle is deep to the ligament. Okay, the next one is the cruciate ligament. The anterior cruciate ligament extends posteriorly and laterally from the point anterior to the intercondylar area of the tibia to the posterior part of the medial surface of the lateral condyle of the femur. The ACL limits hypertension of the knee and prevent anterior sliding of the tibia on the femur. This ligament is stretched or torn in about 70% of all serious knee injuries. The second one is the posterior cruciate ligament, which is the PCL, extend anteriorly and medially from a depression on a posterior intercondylar area of the tibia and lateral meniscus to the anterior part of the lateral surface of the medial condyle of the femur. The PCL prevents posterior sliding of the tibia when the knee is flexed. This is very important when walking down the stairs on steep incline. Okay, there are 5 knee bruces, which is the suprapatellar brusa, the prepatellar brusa, the deep infrapatellar brusa, subcutaneous infrapatellar brusa, and pretibial brusa. Here are the 5 brusa: suprapatellar brusa, superficial prepatellar brusa, deep infrapatellar brusa, superficial infrapatellar brusa. Muscles of knee. Quadricep, which is divided into 4: vastus medialis, intermediate, lateralis, and rectus femoris. The hamstring, which is also divided into 3: bicep femoris, semitendinous, semimembranous, gastrocnemius, popliteus. Okay. Vastus intramedialis, lateralis, and medialis. The origin of these muscles are anterior femur and linea aspera. The insertion is tibial tuberosity via patellar tendon. The action is knee extension. The nerve is femoral nerve. The roots are L2 to L4, and the vascular supply is lateral circumflex. Next one is the rectus femoris, which is the origin of it anterior inferior iliac spine, and insertion is tibial tuberosity. The action is hip flexion and knee extension. The nerve supply is femoral nerve. The roots are L2 to L4, and the vascular supply is lateral circumflex. Okay, bicep femoris. The origin. Okay, the bicep femoris is divided into 2, which is the long head and the short head. So the origin of the long head will be ischial tuberosity. The short head will be lateral lip of linea aspera. And the insertion will be both insertions are the same, which is the fibular head. Action of the long head is extend hip and flex knee. Short head is flex knee. The nerve of the long head is tibial division of sciatic nerve, and the nerve of the short head is common peroneal nerve. The roots are L5, S1, and S2, and the vascular supply is inferior gluteal. Thank you.